I'm Heather McGowan and I work for the DC Department of Youth Rehabilitation Services. Youth Rehabilitation Services is for court-involved youth that have been committed to our care and custody. Basically, we use the CAFAS to guide the discussion in our team decision-making meetings. So we administer that every 90 days and then use that in those team meetings with the young people and their families. What we do is we look at each subscale, and where those subscales show some type of impairment, we focus on that and then offer the young person services to help match those needs.
My name is Cambridge Gray and I work at Community Connections, which is a nonprofit mental health agency here in DC. We give the CAFAS at intake, so it definitely helps us see how the child is functioning at the beginning of services. It gives us a common language to use with the families because we do it with them. Before, we didn't really have a mechanism to measure how well a child was doing, and so by using the CAFAS, we can now track their progress throughout the course of treatment.
My name is Darren Foster and I work for the Youth Services Division with the Department of Human Services. With the PASS program at the Youth Services Division, we provide intense case management services for youth, adolescents 17 and under through our PASS program, which is Parent and Adolescent Support Services, and our ACE program, which is the alternative to the court experience. Well, I think the CAFAS allows us to benchmark behaviors. It allows us, the social workers and the case managers that are working with the youth, that are working with the families, to give us a framework on how we could provide those services, how we can start to move and change behaviors. I think that's where CAFAS has been a really big help to us.
My name is Coral Boswell. I work for Child and Family Services here in the district. CFSA, Child and Family Services, is committed to the well-being, permanence, and safety for our children in the district. So our services are in line with that. We've noticed significant improvements with the CAFAS being utilized at red team meetings, one-on-one group supervision, peer supervision meetings. We're actually now having lawyers ask for the CAFAS score and ask for the child's functioning in day-to-day. So it's really amazing seeing those changes over time.
Some of the stories I've heard, and one in particular that sticks out for me, is a family that was working with one of our agencies. And at that meeting, they presented to the family a set of scores. From that assessment, the family, or the mother in particular, was able to identify an area of progress and was actually able to correct the service provider on one of the scores, saying, no, I know my child has gotten better because his grades have improved this time. Again, it's the practicality of the tool and how it's very easy to understand and very useful in really assessing progress, because families, all we want to know is, how are our children doing? Are they getting better? And not only is that important to families, that's important to service providers as well. We want to know if we're effective. This tool is really beneficial in that sense, is that it gives us concrete data on the progress of our children and youth in services. The bottom line is that the CAFAS and PECFAS are tools that are meant to really just help us see, are our children and youth getting better?